I am delighted to invite up Tyler Norris, who is the Chief Executive of Wellbeing Trust. And Tyler was actually also one of the authors in the journal, so you can take a look at his article. And he's going to provide some big picture inspiration for where we can go from here. So please welcome Tyler.
Good morning. Laura, thank you for a beautiful opening, and Naomi for hosting, I think, one of the most important conversations in the country, this intersection of mental health and well-being and equitable community development. Before we jump into that intersection, I just want to acknowledge the San Francisco Federal Reserve Bank for the role it has been playing, not only for decades in this theme, but specifically for the last 10 years. And David, your leadership with so many others on this team, hosting over 50 conversations of significance around the country about the intersection of health and community development and what needs to be done. 3 major publications, dozens of spin-off articles, and I would say has helped shape grant making, community development thinking, community development finance institution work, and is literally changing the conversation in the nation. So thank you for that leadership. It matters, and this country is paying attention. Thank you. And we better pay attention, because it's not only the right thing to do as a country that believes in equity of opportunity, but a country that is challenged in will we have another 250 years as a strong United States of America. Because without an agenda rooted in economic inclusion, we will go the way of most civilizations. About 250 years. We are 7 years out from our 250th birthday. And I think the question we need to be asking is, what will it be? We've just passed the 3rd year in a row of declining lifespans, which is driven by the diseases and deaths of despair, underneath which are these core themes. I began my work in this about 35 some years ago, inspired by the great community developer James Rouse. And his mantra became mine, that a healthy community is a garden to grow people in. My first foray was on the streets of Denver in my early 20s, when I joined with a group of women and men trying to stay sober and go to work every day in an effort now called Step Denver. And I met about 7 or 8 guys in a storefront at 21st and Larimer who were literally just trying to hold their lives together, use AA, self-support, pay a little rent every night to their own accommodation, and going to work and actually getting jobs. We helped form that up into a board and got a couple months ahead, but we kept eyeing the old A&P supermarket across the street, which had 30,000 square feet, 3 stories, and I kept going, God, we are bursting at the seams. So another board member and I went down to the Disabled American Veterans who owned the building, and about 40% of the residents in the program were veterans, and mental health and substance use disorders were well over half, of course. And gosh, if we didn't walk out of that meeting within about an hour with them giving us the building for 10 years. And it was one of those things where I remember my conversation with Kathy Ellis, this fellow board member, was like, what have we done? we had no money, no plan, no people. And I remember the conversation, we came back, the men were having an AA meeting, and the guy who kind of holds the door with a bear hug or a baseball bat, whatever he needed to do to manage the street, kind of said, we don't even have a blanking plumber, right? At which moment, one of the guys in the AA meeting says, well, I'm a blanking plumber, stood up, big guy. And he goes, and I used to run one of the biggest plumbing companies in this town before my drinking and drugging caused me to lose my family, lose my job, lose my company. And the guy next to him stood up and said, and I'm a blanking master electrician. And we kind of went, well, and took a little survey of the guys there. We found that we had every single skill in the program of men who have been given up on all the 30, 60, and 90 programs that were needed, every skill. And in fact, we not only, one of the guys even knew the president of Southern Lumber, and they gave us the money to rehab the thing. 9 months later, nobody outside of the program ever lifted a hammer or paintbrush inside that building. And 35 years later, it is still operating in that building, run completely by the men in that program who everybody always gave up on. They went to work every day, living wage. It was just a transitional program to permanent housing and permanent jobs. But that was actually spinning the economic development flywheel of the community. And at this intersection, and I learned so much from that. One, at the heart of it is we have all the assets we need. It's all there in front of us. The resources, the buildings, the people, the opportunity. It's a question of whether we can see it and open our minds. And in that case, those men opened our minds to being the asset to start with, right? The first article I ever wrote with the Federal Reserve Bank 22 years ago with Jack Richards, his predecessor in community investment, was focused on asset-based community development with Tom Matrano at the time of Bank of Hawaii. On that basic premise of our communities have the assets that we need. Secondly, is communities the solution, right? When we talk about what builds well-being and resilience, and the beautiful framing, Laura, that you did at the start of this, it's about people having a sense of purpose and meaning, which those men and women in that program were finding. A sense of belonging, secondly. I have a place to go and be safe, where I am welcome, and I know I'm okay, and I know that I belong. Third, awe and wonder, the ability to be delighted or by something beautiful in our lives, which of course those men gave each other and us all the time through their perseverance and their courage to face what they did every day. And fourth, an opportunity to give back through service in a meaningful way. We kept asking the question after we did this building, and we need to just do that again. How do we keep doing that to include? It's not just about economic inclusion and inclusion being so important. It's about co-creation in the process. That was the flywheel that is well-being producing of not for, but actually with, that must be at the center of this piece. And that as we draw people into this work, recovery is about the recovery of human beings and the recovery of buildings and neighborhoods and downtowns at the same time. That as we reclaim human lives, we reclaim our neighborhoods at the same time. That is how intimate this connection is and how profound it is at the heart of those issues that we care about. Well, now, 30-some years later, I have the opportunity to lead what is now the only national scope foundation focused on mental health and well-being in the country, Well-Being Trust. And we are just getting going and talking with Amy Price and others, funders in this room, my friend Jean Noodleman and others from Kaiser Permanente. One of the first things we released with the Robert Wood Johnson Foundation and Trust for America's Health with the Pain in the Nation report, right? 1 million lives lost in the last decade. A doubling in the past decade of diseases and deaths of despair, alcohol, suicide, and opioids, and a projection of doubling again in the next decade. Nothing happening on our watch, that's what's happening, right? Underneath it, loneliness, hopelessness, isolation, lack of economic inclusion, racism in every way, direct, personal, structural. The fundamental issues of our democracy and our economy. I was having a conversation the other day about capitalism. The conversation was, it is easier to imagine the end of the world than it is a new form of capitalism that is fundamentally inclusive and benefits all Americans. That's how pernicious the conversation really is right now, at the heart of that. So these mental health issues are the leading cause of disability. in the country, comorbid with 40% of visits in our healthcare systems. And in the emergency department, in a lot of settings, well over 50 and 60% of visits. So that's kind of where we start. So here we are as a foundation, just to give you a sense of our thinking about that, we've got 5 major focus areas. One of them at Wellbeing Trust is clinical transformation. We know we have to integrate mental health with physical health. Hello? Spirit, mind, body, whole person care. And if we're not talking to somebody about their depression, how could we possibly talk with them meaningfully about their diabetes or hypertension and eating healthier or moving more when the substances are the way somebody self-medicates their way through the day? Exactly, like all the rest of us do, too. So that's key, that we have seamless integration, whole person care across the continuum of care, from acute care in the emergency department, all the way to primary care, all the way to the systems of prevention and health promotion and recovery in the first place. That's job one, and we are doing that work with the Institute for Healthcare Improvement, dozens of health systems across the country to transform care. That's hygiene, and it won't even begin by itself to turn the needle that we need to do. So it's just a piece of our agenda. Secondly is our policy agenda, led by Ben Miller, our Director of Strategy. We're working with a bipartisan policy center and Academy Health and United States of Care and the Kennedy Forum and others to help shape the next generation of mental health parity, which, by the way, is in fact the law of the land, that your access to mental health care and substance use ought to be of the same quality and standard and accessibility as physical health care, but it's just not true. And businesses and states and insurance companies have a long ways to go to actually deliver parity. And we're committed to what the next decade of that needs to look like, as well as by addressing, and we have with BPC, a bipartisan mental health policy agenda for the future. And that's another big piece, so that we increase affordable access to high-quality mental health and substance use treatment with standards and a no wrong door approach. Right? That is a key piece. But even if we get the clinical work right and we get the policy work right so more people have access to it, that is not going to turn the tide by itself on what is driving these underlying issues, which is why our community strategy is really at the heart of this, and why, as a person who's been focused in community so long, it's such an honor to be able to help focus on this. So we've been asking the questions. Yeah, we got to do this clinical work and the policy work. We need to open conversations with tweens and teens, as we have in dialogue with iHeart, and we're training DJs to make sure that young people, that it's normal to talk about mental health issues and substance use issues and thoughts of suicidal ideation, and to get help and give help and show as a friend. We're doing all of that. But the underlying question is, how do we create the vital conditions for intergenerational well-being in the first place? Pathways of potentiation, to the frame that Laura gave us at the beginning. And what does that pathway look like? Many of this room, myself included, and my kids at the top of the list, have directly benefited from the privilege of us, their mom and I, being able to put together a pathway for their potentiation, right? What does that look like for all kids? That's privilege, to be able to have access to a pathway for human flourishing. That is a birthright. It is what our Constitution calls for. It's who we are as a people. And that means that it is our job, because it is the right thing to do, and it is the precursor of a strong United States economy, for us to assure basic needs to health and well-being: food, housing, jobs, safety, childcare, senior care, lifelong learning, from the first 1,000 days, as George Halverson would remind us, all the way to the end of life. Meaningful work with living family wage jobs. That's the precursor to a strong United States of America. Humane housing, that is a platform for health. Like we've been writing about with enterprise community partners and others. Reliable transportation. And most of all, a society that creates a sense of belonging and that has civic muscle, where we use the power of our democracy to ensure that we invest in the things that create health in the first place. That is our job as residents and citizens of this country, to ensure those vital conditions as a precursor. Community, as David and Ian Galloway and others have articulated so perfectly, community produces health. The health sector is increasingly needing to buy that health. The marketplace that values health care makes companies wealthy through the volume of services. An economy that values health buys health from community and benefits human well-being. It is incumbent upon the health sector to recognize that it needs to buy what community produces, which is those health factors, right? So when banks and community development finance institutions work on Community Reinvestment Act projects with hospital community benefit, we have the opportunity to make grants and develop strategies to improve health. The anchor institution strategies, where hospitals step up, like Kaiser Permanente has, to shift its purchasing to buy local, to shift its impact hiring to hire local, and to use its Wall Street investment accounts to invest in Main Street, to actually do community lending and build housing and that, you start to see a virtuosity of the assets of the health sector to purchase health through these other levers, right? That's actually what these needs to look like. And when we treat somebody in the care setting and we acknowledge these social needs and we say we're going to make the assessment and referral to those non-medical needs a standard of care, then we use those anchor institution strategies to actually build the capacity of the community to deliver those services in the first place. Not just make the referral, but in fact invest in the capacity of the community to meet those needs. That's the virtuosity of this health care, community development strategy that actually needs to be at the center here. And why not only community development housing, but efforts like My Cultivar up in Richmond that is hiring formerly incarcerated individuals to aggregate and distribute locally produced food, sell it back into the health systems and universities, right? Living wage jobs, it's a cooperative, so there's actually a chance to even own part of the company. And those dollars are the food is going to lower income individuals and being in food carts and in cafeterias and in patient rooms. You start to create a community development house. I remember early conversations at Kaiser Permanente with physicians go, yeah, I'd love to write a food prescription, but there's no structure for fulfillment. You know, you write a prescription for metformin and they go to the pharmacy. Now you write a prescription for food and you start to see a community economic development structure for fulfillment on the backside, and that food prescription can start to happen, right? Because community development, that's the virtuosity of what we're actually seeing happen here. So Wellbeing Trust, with so many of our partners across the country, is not only committed to clinical transformation, to shaping federal, state, and local policy, to changing the dialogue in the country and innovating around parity and standards. We are committed to assuring the vital conditions for intergenerational well-being. We're partnering with dozens of communities across the country that are doing deep, place-based work, not just tinkering and doing the right thing, but saying we are accountable for the outcomes of our community, right? Doing deep, place-based work, and are building a national alliance of housing and transportation and early childhood development and food system and other national organizations for a well-being alliance that is rooted in the American pragmatism and transpartisanship of our nation, where people just get it done. Red, blue, rural, urban. We know how to get things done. And that American pragmatism and that transpartisanship is what I believe we are needing more than ever in this country right now in order to cut through the political craziness and root ourselves back in what our communities know works. And that Wellbeing Alliance that we see forming nationally across the country, we believe is part of a new agenda for well-being in this nation that makes us not only live up to the greatness of who we are as a country, but build an economy that is worthy of the people that we are. Thank you for this time, and I am very much looking forward to the conversation that will come.